Welcome back to Ladies of Another View, and I want to welcome back our next guest, Mark Mostert, who is a PhD with senior researcher with Able Americans. It's one of the National Center for Public Policy Research is the whole name, but they go by National Center, and it's part of one of their projects to support Able Americans. Welcome to the show, Mark.
Thank you so much. Wonderful to be with you and to talking to people in North Dakota. I lived 8 years of my life in Fargo, and I loved it.
Wow, I didn't know that. You're originally from South Africa. You might notice the accent. So what were you doing in Fargo?
At that point, I was a college professor. I lived in Fargo, and I taught across the river in Moorhead, Minnesota, at what was then Moorhead State University.
Okay, and you have many years, 35 years in academia, and the last 20 at Regent University, where you're a full professor of special education. So this is a special focus of yours. And just recently, there was a press release that came out that Able Americans offers policy solutions for 100 million Americans with disabilities and their caretakers. What's going on there?
Well, in the press release, we noted that there are over 65 million Americans with disabilities. And if you include the people who caregive for them, you're looking at about 100 million people that access or need to access services both at the state level and federally in order to get the services they deserve and that they need. And of course, what you run into is this massive bureaucracy, certainly at the federal level, where people cannot access information, let alone get to the services they want in a very efficient way. So Able Americans is a program within the National Center, and we started out with one project under Able Americans called Project Access. And what we did was we said, let's look at these agencies and let's take what people say. They can't find information. They can't access what they need. So we went through the Department of Health and Human Services, plus also Medicare and Medicaid. And we found all the program, well, most of them, not all, programs, supports, research, resources that people could access, and we cross-tabbed those with 22 disability categories. And we just launched the website last week. So if you have a child with a learning disability, for example, you can click on learning disability and it'll take you to all the programs, resources, and research on disabilities right across that federal agencies, making information much easier to get and therefore more accessible to people that need it.
Mark, I want to know if they want to access this, where's their starting point? What's the website they should go to?
Go to the nationalcenter.org website, and under Able Americans, the website is right there. It's called Project Access within the Able Americans tab at the National Center for Public Policy Research.
Okay, so nationalcenter.org, and then you look at the correct tab there. Okay.
Well, and that's the biggest thing. I mean, first of all, people don't know where to access it. And then when you do get it, I mean, one of the big things, federal programs have a tendency to fraud and waste. So what is going on in the whole big picture of it?
Well, I think one of the basic reasons is that, as I said, bureaucracies start out meaning well and with fairly decent ideas. What happens is they'll form a policy or a program, and then there will be exceptions or problems with that policy or program. So they will then band-aid onto that policy or program another little bit to take care of that problem. And then, of course, another problem comes up. So they band-aid it again. So after 30, 40 years, you have a massive bureaucracy of programs, resources, whatever, all bunched together, all with this band-aid solution that's been added millions of times. And that makes it very difficult to navigate. And it's not only the navigation problem, it's the fact that people need the information to access services. And if the federal government cannot provide access to services, then they shouldn't be in the business of trying to help people with disabilities who need the help yesterday.
Well, we're keeping our fingers crossed that they actually are trying to help and that what the federal government can't do, the locals will pick up on. Because from your information here, according to Research Center, some 46% of Americans ages 75 and older and 24% of the ages 65 to 74 now report having a disability as well. So it's not just people that were born with one, they are acquiring them. So that number is going to keep growing exponentially, is it not?
Yes, it is. Certainly, with boomers retiring, the basic rule is the older people get, the more likely they are to have all kinds of disability problems, and probably more than one at a time. So there's comorbidities, and people need help as they age, and that of course creates a whole medical disability population that we don't often think of when we think of disabilities. We think more often of learning disabilities or someone using a wheelchair, but it's across the lifespan, disabilities from birth until old age that need to be looked at in a much more efficient way.
You know, I didn't really realize until I started having babies and had to push a stroller. I started out in downtown Portland and realized all the places I couldn't go.
Right?
Yeah, and so you don't always think of it if it's not your problem, if it's not, you don't have somebody in your family. But like you said, as we get older, as we age, oftentimes you get more disabilities. I know that, like with assisted living places, a lot of times you need an accelerated level of care as you get older. So ultimately, this is about all Americans, right?
Absolutely. About all Americans, everyone has a disability story. Everyone knows someone with a disability or has a disability themselves. And the story that we're trying to tamp down is we don't want people to have horror stories in trying to access care, both at the federal level and at the state level.
Okay, when we come back, I'm going to talk a little bit more about fraud and waste because I really feel like it's a crime, a serious crime on the backs of trying to help disabled people where people are lining their pockets and involved in that sort of thing. So don't go away, we'll talk about that.